The U.S. Surgeon General releasing a landmark advisory on gun violence in America. Dr. Vivek Murthy declaring gun violence a public health crisis. Riley Phillips is on your side tonight, taking a closer look at this report and what families who lost loved ones to gun violence are saying. Riley?
Yes, this 39-page advisory dives into the data and evidence surrounding gun violence in the country and details ways communities can try to curb the crisis. The one Jacksonville mother whose son was shot and killed a few years ago says now action needs to be taken.
24, good kid, very talented.
Katrina Cook lost her son Brandon in 2018. He was shot and killed in his car in the Sherwin-Williams parking lot on Townsend Road.
It's a sad feeling, a hurt feeling, feeling of loss, feeling of just despair.
Cook says the Surgeon General's advisory should have come sooner.
We need to do something. We're losing babies.
The 39-page advisory breaks down the research compiled over the last few decades on gun violence and its effects on the population. According to the report, 54% of adults or their family members have experienced a firearm-related incident. 6 in 10 adults also say they worry sometimes, almost every day, about a loved one being a victim of gun violence. Colleen Rodriguez, the CEO of the LJD Jewish Family and Community Services, says this stress and anxiety about shootings impacts the entire community.
It changes our ability to feel safe, and if you don't feel safe, what does that do?
The advisory also focuses on children and gun violence, stating half of 14 to 17-year-olds in the U.S. worry about school shootings because of the impacts this is having on mental health. Rodriguez agrees with the Surgeon General declaring this gun violence a public health crisis.
I think I'm glad this happens so that we can start having real dialogue about how it's impacting mental health.
Cook says she appreciates the report. Cook says she appreciates the advisory, but now she expects action to be taken.
All that stuff that we were talking about, now that you've declared this, it's time to get to work.
And the Surgeon General says there needs to be a collective commitment of the nation to put an end to this crisis, similar to the way smoking and tobacco-related diseases were addressed in the U.S. He says there needs to be more investment in research, education, policies focused on prevention, and more support for mental health. Riley Phillips, First Coast News, on your side.